from clinical pathology to the theory of neural computation to the future of peer review. Today's episode explores three very different ways AI is changing: science and medicine. We'll look at a long foundation model that is already improving diagnosis and workflow in real hospitals, a deep theoretical result linking holography, polynomials, and neural networks, and a bold study showing where AI reviewers can help and where human expertise still matters most. Let's explore the first paper, a clinically validated foundation model for comprehensive lung pathology interpretation. Pommel Foundation is a lung-specific foundation model built by continual, self-supervised pre-training of Virchow 2 with LoRa, adding only about 2 million trainable parameters, 0.3% of the 632 million parameter backbone. It was pre-trained on 39,503 H&E whole slide images and 88 million tiles from 12 sources, then evaluated on 26,643 WSIs across 32 clinical tasks covering biopsy diagnosis, frozen section triage, resection-based staging and grading, molecular biomarker inference, and survival prediction. The model consistently outperformed pan-cancer baselines including UNI, Virchow, 2, Chief, and GigaPath, with especially large gains on lung-specific morphology tasks such as CK5-6 prediction, P63 prediction, Ki67 inference, TMB prediction, pleural invasion, and lymph node metastasis. In retrospective validation, it reached macro AUCs of 0.936 for biopsy tasks, 0.908 for frozen sections, 0.921 for resection diagnosis, staging, and C indices up to 0.79 for LUAD overall survival. In a prospective observational study of 1,357 consecutive patients, it achieved an average AUC of 92.3% across 11 tasks, including 0.992 for biopsy, benign versus malignant, and 0.97 for frozen section, benign versus malignant. Pre-specified triage thresholds reduced second review burden by 68.8% of biopsy cases and 83% of frozen section cases, while deferring 44.5% of IHC orders at PPVs of 1, 0.991, and 0.966. In a crossover randomized controlled trial with 8 pathologists and 4,928 matched reads, AI assistance increased diagnostic accuracy from 83.8% to 91.7%. OR equals 2.23, 95% CI 2.052.42. Reduced median diagnostic time by 19.6% and improved Fleiss kappa from 0.56 to 0.76, showing clinically meaningful workflow benefit rather than benchmark-only performance. Let's explore the second paper, holographic functions and neural networks. Balazs-Segedi's paper introduces a dimension-independent complexity theory for fuzzy Boolean functions, F01, N01, and proves an equivalence between three notions: holographic recoverability, low-dimensional polynomial structure, and bounded neural network representability. The holographic property says that f and x can be reconstructed up to small error from k randomly sampled coordinates, with test functions allowed to depend on the sampled locations. The structural counterpart is approximation by a degree at most k polynomial in at most k bounded linear forms with 1, norm-bounded coefficients. The computational counterpart is approximation by a bounded Lipschitz-directed acyclic network with at most k non-input neurons and bounded incoming affine norms. The main theorem shows these properties are qualitatively equivalent with explicit parameter blowups. Holography implies polynomial structure via a weak hypergraph regularity or box regularity. Lemma, polynomial structure implies neural realizability by an exact multiplication gadget built from clipped squaring chi t equals min 1 max 0 t si uguale a do, and bounded networks imply holography by inductively sampling bounded affine forms using Hofting's inequality. The paper also proves that allowing different sampling measures per query is qualitatively equivalent to using one common measure with a sample overhead OK log 1 epsilon. Novelty lies in identifying holography as the bridge between distributed redundancy in high-dimensional data and bounded neural computation. Let's explore the third paper, on the limits and opportunities of AI reviewers. reviewing the reviews of Nature family papers with 45 expert scientists. This paper evaluates AI reviewers at the level of atomic review items rather than overall accept, reject scores using 45 domain scientists who spent 469 hours annotating 2,960 criticisms across 82 Nature family papers from physics, biology, and health sciences. Each item was judged on correctness, significance, and evidence sufficiency, revealing a non-trivial trade-off. GPT-5 2 reaches 60% fully positive items and outperforms the top-rated human reviewers 48.2% on the composite metric p equals 0.009, while Claude Opus 4.5 and Gemini 3 Pro remain statistically below or near that benchmark. The distinctive gain is not generic agreement, but coverage of different issues. AI reviewers surface 26% of criticisms with no human counterpart, and those unique items are still 81.8% correct and 93.5% evidence sufficient, although AI reviewers overlap with one another far more than humans do, with same target, same criticism overlap at 20.9% versus 3.4% for human-human pairs. The main failure modes are also specific. Experts identified 16 recurring weaknesses, led by subfield, norm, miscalibration, long context failures that miss information elsewhere in the manuscript or supplement, and over-harsh critiques of minor issues. The authors packaged the study into Peer Review Bench, a 7-8 paper benchmark, and CMU paper reviewer, an open hands-based reviewer service that adds code, inspection, and citation filtering, but their conclusion is conservative. Frontier LLMs can augment human peer review, especially for code-heavy and statistical scrutiny, yet they are not substitutes for a diverse human panel. That's a wrap on today's AI paper highlights. Thanks for watching.